Good afternoon, everyone. Welcome to our lecture today. My name is Qin Gao. I'm a faculty member at Columbia University's Weatherhead East Asian Institute. I'm also at the School of Social Work, where I serve as the Associate Dean for Doctoral Education. I'm also the Acting Director of Columbia's Asian American Initiative. Very happy and honored to have us all join together to talk about a topic that's very dear and near to many of us. Today's lecture is part of our annual lecture series titled COVID-19 Governance and Impacts, China from Comparative Perspectives. Today, I have the great honor of having my two colleagues and collaborators co-presenting with me. Sitting next to me is Stacie Tao, a postdoc fellow at University of Chicago, and also April Go, who is a master's student at Columbia School of Social Work, also a fellow at the China Center for Social Policy. Thank you all for joining us both in person and online. For the online audience, please feel free to enter your questions throughout the time into the Q&A box, and we will turn to your questions. Same for the in-person audience. So I'm going to move to the podium now. And I'll share screen. I think we need to go back. Yes. So thank you again. Our presentation today is titled The China COVID Project, Document History, Advanced Analysis, Foster Collaboration. These images were taken on December 8th, 2022, when my collaborator, my colleague, Professor Wang Feng of UC Irvine, and I took a walk in Central Park. We paid tribute to Dr. Li Wenliang, who was the whistleblower, one of the main whistleblowers to COVID in China. It's hard to believe, if we think back today, 6 years has passed since the initial outbreak of COVID. Yet COVID still stays with many of us in ways big and small, worldwide. So how do we know exactly what happened? How do we document that history and provide meaningful analysis so that if one day this kind of crisis happens again, we can deal with it better and we can support people's well-being in a more holistic, systematic way? So on that day, through our walk in Central Park, Professor Wang Feng and I thought we have this responsibility to document this history, to foster analysis and build a collective of scholars who can do this work. So we decided to pursue this project. We were very fortunate that when we submitted a grant application to the Henry Luce Foundation, they liked our idea. And their vision and mission aligned with ours, that we have to be compassionate social science researchers. We have the responsibility to document history and learn lessons from history. So we were fortunate to be supported by this grant from the Henry Luce Foundation. We named the project China COVID Project. The full title is The Social, Economic, and Health Impacts of COVID-19 in China. We really want to look at COVID-19 holistically to see what happened, how it has impacted people's lives, and what policy changes need to happen so that if a similar or different crisis happens again, it could be dealt with better. We have 3 goals for this project. First, we want to build a clearinghouse of data and archives so that in the future, if people want to study this topic, they have a place to go. that's already compiled the different data sources and archives. So that's what we are working on. The second goal is to carry out a set of coordinated research on COVID impacts. We look at the health impacts, economic impacts, political impacts, cultural impacts, so that these different kinds of work can be put together so scholars can dialogue with each other. So that's the second goal we are pursuing. Lastly, we want to establish a scholarly consortium across disciplines, institutions, continents, so that we are not scattered anymore. We can come together, debate, dialogue, and put forward some research findings for the world together. We have this growing scholarly consortium. We are so proud. We have 6 core team members across US universities. We have, at this moment, 84 participating scholars, including 17 postdocs and students who are considered early career stage scholars. They are across 35 institutions and across 3 regions. We look forward to continuing to build this consortium so that more scholars at different career stages, different institutions can join us with this great effort. We pursue 6 core areas of research concerning COVID impacts. There are so many different ways to look at this and investigate this, but we focus on 6 core areas. The first is the demographic outcomes and behavioral changes. So birth and death, how are the demographic data impacted? What are people thinking in terms of changing their behaviors? Are they more likely to get married, to have kids, to move around? So these are the set of questions we are looking at. Professor Yong Cai at UNC Chapel Hill is leading this bucket of our research. The second core area of research is education and transition to labor market experiences of Chinese students. So these are young people who are thinking about their future, whether to go into further education or look for a job, and whether they pursue that career path in China or elsewhere in the world. So this is combining qualitative and quantitative research led by Professor Yingyi Ma of Syracuse University. The third core area of research is economic activities and livelihood. During COVID and since COVID, who have lost jobs? How are people's income flows being interrupted? How are migrant workers doing? How are people reshaping their consumption decisions? So this bucket of work looks at economic activities, livelihood, and how people think about their economic well-being going forward. This work is led by Professor Wang Feng of UC Irvine. The fourth area of research focuses on mental health and subjective well-being, which is a huge topic, I think, not only in China, but worldwide. COVID had a big impact on how we live, how we use our time, how we treat ourselves and treat each other. So the broad scope of mental health impacts and subjective well-being, even the hopefulness, how we think about future, is very important. I lead this bucket of work for our team. The fifth core area of research is on digital infrastructure and reshaping of bureaucratic power in China. Probably most of you know that since COVID, the QR codes have been popularized everywhere. And in China, for a long period, you have to show your green code or yellow code or red code. So you have to go everywhere and show a code in order to do your business, live your lives, and carry out work activities. So how does that impact governance, people's lives, and how does the system react to some interruptions built by this system? Professor Yan Long from UC Berkeley is leading this bucket of work. And lastly, our number 6 area of research is on cultural response, political attitudes, and people's participation in political activities. This work is led by Professor Bing Xu at Emory University. How do people and how does the government make sense of COVID? And what's the narrative behind this? What happened? Who is responsible? And how should we move forward with these narratives, these memories, and these cultural implications. So that's this area of core inquiry we are pursuing. These are separate, but also integrated together. We talk to each other, we share our findings, we even look into the different data sources we use and then think, what's the implication of, for example, digital infrastructure for people's mental health? What are the youth pursuits for their future? How do they impact the political attitudes of the young people? So these are interacted with each other. Alongside these research and consortium building efforts, we've launched a series of public-facing events. Today's event is part of the COVID-19 Governance and Impacts Annual Lecture Series. We've had 4 lectures in this series. And after today, we have 2 more that's coming up in April. So these are scholars who conduct COVID impact-related research in different topic areas from different institutions. We welcome you to join our future events. Then we also have these workshops and conferences really to investigate how has COVID impacted people's lives, what lessons can be learned for future better decision-making. Now I'm going to turn to my colleague Stacie Tao, who will talk about a set of books on COVID in China that we've reviewed as part of this effort.
Wonderful. So nice to see everyone. And thank you so much for joining us. Thank you, Dr. Gao, for that wonderful introduction. It's so wonderful to see how this project has evolved. It's hard to believe that it's only been 2 years, but it's so exciting to see all that has come out of this. So I have the pleasure of sharing with you all some of our team's recent efforts to gather and synthesize these major books that were published on COVID in China. And so up here, we're showcasing 7 titles, as you can see, between 2021 and 2024. And these books range from the origins of the pandemic to insights into Wuhan specifically as the city with the first known outbreak, as well as the pandemic's ties to global health issues, also its implications for international relations. And of course, there are some more books that are being written by our colleagues, many of which Dr. Gao earlier mentioned that are involved in this project. So that's all very, very exciting. Okay. So among these books, our team selected 3 titles. And around these 3 titles, we wanted to address a guiding critical question. And that question was, what does it take for a government to remain its legitimacy during a crisis? And so we examined the COVID-19 pandemic response in China as a case study of sorts for this question. So today, I will give you a brief overview of our book review that we published in the International Journal of Public Administration. It is titled State Power Under Pressure, Governance, Legitimacy, and Civic Response During the COVID-19 Pandemic in China. And this was a collaborative effort with my colleague April Go over here and Dr. Gao as well. Okay. So the first book that we include in this review is titled Authoritarian Absorption, The Transnational Remaking of Epidemic Politics in China. And this is by Yan Long, and this was published in 2024. So Yanlong argues that China's pandemic governance system was not improvised in 2020 at the onset of the pandemic, but rather it had origins that date back to the 1980s during the AIDS and HIV crisis. And through decades of engineering of the selective incorporation is what Yanlong calls, or otherwise known as the absorption of global health norms. And this was all for the purpose of serving an authoritarian agenda. The next title that we include is Wuhan, How the COVID-19 Outbreak in China Spiraled Out of Control. And this was written by Dali Yang in 2024 as well. And in this title, he documents in great detail the breakdown of bureaucratic systems during the early phases of the pandemic crisis in China. And so he goes into detail about the disconnected infrastructures that prolonged crisis response and therefore set a stage for this vastly spreading virus, the COVID-19, and which ultimately led to very stringent lockdown measures. The last title we include is titled The Wuhan Lockdown by Guobin Yang, and this was published in 2022. And this title shifts from the first two in the sense that it utilizes citizens' civic experiences to showcase how everyday people, community members, grassroots organizers, how they reassembled their communities from the bottom up. So as you can see, our review follows this arc. We begin with the institutional construction, otherwise known as the roots of this pandemic governance system that absorb practices from prior public health systems. We move to its breakdown during the onset of the pandemic. And lastly, we close with reassembly, how it eventually endured and how it relied on everyday people through their civic actions. Okay. So I'm going to share a bit more about our first title, Authoritarian Absorption by Yanlong. So this is a 3-part title, and they reveal many surprising insights into China's infectious disease system. Again, as I mentioned, the response wasn't improvised in 2020, rather it had roots that span back. So this title relies on ethnographies, interviews, archival research, and they do a rich analysis that demonstrates how China absorbed these global health practices. Namely, they note surveillance systems, performance metrics, and participatory language, and how they adapted them for authoritarian control. And so through this historical lens, Yanlong broadens our view past the pandemic's context to explore the origins of their public health governance response system. So between 1978 to 2018, their infectious disease system went through many drastic changes, including a collapse, reinvention, and also ultimately a very dramatic expansion. So Long analyzes how many players, such as foreign health organizations, Chinese officials, grassroots activists, they all came together to reshape the state of epidemic control. And so by situating it in this manner, she traces how international health norms were absorbed and simultaneously transformed. So these interactions of different players from this historical lens, not only strengthened the public health institutions, but also reinforced authoritarian rule. And so all of these events set the stage for China's handling of the COVID-19 pandemic. Long invites us to think about how authoritarian states adapt global ideas, less to liberalize and perhaps more to increase government capacity, as well as to project global power. So that was the first title in our review. The second title, wonderful. Okay. Wuhan by Dali Yang, published in 2024. This title is a detailed chronicle on how multi-level governance failures unfolded during the crucial early periods of the pandemic. And so this title utilizes media records, official statements, internal reports, and a lot of firsthand accounts to analyze how China, what's known for its top-down systems, silence designated targets, mobilize resources, all to regulate behaviors. And some examples that Dali Yang highlights in this book was, for example, labs were instructed not to release data and information, or they also regulated hospitals from testing their own staff members. So ultimately, the story that Dali Yang tells of the pandemic's outbreak is a story of institutional and political dynamics that largely contributed to the failure of containing the virus. Okay, I'm going to move on to our last title, The Wuhan Lockdown by Guobin Yang. This book shifts to highlight the civilian voices amidst the pandemic and the strict Wuhan lockdowns. So Guo Bingyang relies on personal diaries, social media posts, and records of mutual aid efforts and protests, very powerful content, to draw and document attention to the emotional narrative terrain of the pandemic. Sorry. So he presents this concept of civic dramaturgy, this idea that captures how everyday people, through their public performances, whether it's care, grief, mutual aid, especially in the form of diary writing online, were acts of perseverance and hope in the city that was sealed off and surveilled. And so Guo Bingyang dedicates his efforts to highlight the grassroots and to the protests. He highlights the grassroots efforts that were used to protest censored materials outside of the official narratives. One example, a powerful example, was a diarist mentioned that they were rereading their previous posts to just remind themselves and that they had lived those days as a reminder. So while this book steers the focus of our review away from institutional analysis, it completes this arc and it ties it all together to demonstrate that legitimacy relies and needs emotional acts and how it can be reassembled through these shared experiences. So I want to just close our book review quickly by overviewing that we see the different dimensions of governance and legitimacy across these three titles. First, in Yan Long's Authoritarian Absorption, they explore the pandemic's macro level roots, how it was built structurally. Next, in Dali Yang's Wuhan, they analyze the meso level, institutional disruptions. And lastly, how Guo Bingyang shows that it was rebuilt by everyday citizens at the micro level. So with this framework, we map how legitimacy is built structurally, disrupted institutionally, and at last rebuilt by civilians. So some of our main takeaways from this is that authoritarian systems, which depend on top-down control and order, and adaptation and transparency during the crises can become very challenging. And so a large system like China, especially, who depends on this tight control, may have challenges that emerge. A large takeaway here is that legitimacy is not permanent or necessarily fully reliant on how well these institutions perform. It does require maintenance, good design, trust. And so this kind of brings it together to ask this catch-22 dilemma of sorts, where we see that authoritarian governments, while they depend on these trust-based relationships to handle their crises effectively, but if the very nature is to suppress those relationships, does that jeopardize stability and legitimacy? And so our final concluding question that we ask in our review is, can authoritarian systems build adaptive legitimacy before rupture? Or is legitimacy in these contexts always a reactive exercise and repair? So as I was reviewing this and rereading this, it really reminded me of some of the actions that we see today in different contexts. And I think it does beg the question, a very similar question that we should consider, right? From these top-down efforts to censorship and control, we do see that there are many important lessons to reflect on and take away. And I think another powerful takeaway for me was that it reminds me that legitimacy and the road to repairing that does rely on everyday people. And I think it encourages us to see activism and all of our small acts of resistance as powerful and necessary. Okay, that is all I have. I will turn it over to my colleague, April, who will be sharing with us some of our efforts archiving and reviewing some of our special issues on this topic.
Amazing. Thank you, Lou. Okay, it is. Thank you, Stacie. And likewise, thank you everyone for coming here today and listening to us. So in very similar vein, we also examined 9 special issues, which comprises our full data set. They were published from 2020 to 2025. Am I being heard properly? Those are maybe? Yes. Okay, sorry. And they spanned quite diverse academic fields. So in terms of the methodological breadth, they've ranged from large-scale survey data and media analysis all the way to ethnographic fieldwork and narrative inquiry. So it was a very rich collection. And ultimately, the goal is to map a layered tension between state authority and the informal actors who sustained order when the formal institutions failed, in very similar vein to what Stacie talked about. So through the 9 special issues, we collectively identified 3 main themes. So the first theme is state power under pressure. So the first sub-theme of this is the concept of emotional governance, and ideology that the state very much relied on to maintain order. So state media very much transformed, or essentially painted a picture of COVID as a moral trial. So transforming everyday workers into COVID heroes and symbols of loyalty and sacrifice. The second one is information control. So this is governance through narrative engineering and reframing things like restrictions into depoliticized terms like management. The third theme, sub-theme of this is subnational discretion. So despite centralized efficiency or projected centralized efficiency, really what happened was the lived experiences on the ground was very fragmented, and officials very much acted on political perception instead of what they were actually prepared to do technically. And then, of course, political performance, which the economic recovery was very much used as proof of superiority. And over here on the right, you'll see a couple of charts essentially showing you how nationalism was more an indicator of your perceived severity of how bad the COVID pandemic was in China. Essentially, the more nationalist you are, the less science has on how you perceive the COVID virus in terms of its severity. So the second theme that we identified across the 9 special issues is about social infrastructure and informal adaptation. So on the ground, people very much relied on mutual aid networks in the absence of state support. Residents used things like WeChat groups for food and medical coordination, and it was more or less faster and more responsive. So frontline effective labor, where under-resourced community workers and volunteers brokered solutions and absorbed blame, again, in the absence of, state support. And family as infrastructure is another important one, where families, especially mothers, bared a lot of the emotional load. And over to the right, you'll see a chart here. This is reverse scored. I can't explain to you why, but the increase in competence, in emotional competence, actually shows you a decrease in how the children experienced COVID. So the more of a motherly nurturing relationship that children were found to have during COVID, the less their behavior manifested in things like tantrums and so forth. And so the last sub-theme here is embedded surveillance, where digital tools that became the norm, things like mobile phone health codes and so forth. And they very much govern, society on the ground, and it made it very emotionally stringent experience. On the right side, in the top, that is a a quote taken from one of the special issues that says, "I am just another laborer, just like you." And this shows you the affinity, I guess. This is kind of a frontline effective labor that many of the civilians had during the time with each other. So the last theme that we identified is narrative strain and lived experience. So emotional exhaustion being the first subtheme, where official slogans and state media lost traction, citizens very much drifted into feelings of fatigue and detachment. And they very much expressed this through storytelling. On the right side, you'll see a poem written by a mother. I'll let you read that yourself. But you can see that they used these forms of expression as emotional scaffolding to reclaim their voice. So they also expressed irony through these mediums. And for example, to be labeled a sheep during the time was actually a negative thing, meaning you've been marked with COVID. But they did things like owning that and essentially turned medical label into irony. And then now, all of these collective memories are documented and last as a satirical memory against the zero COVID regime that, that existed during that time. So to summarize, these special issues generally, not generally, rather, they very much touched on the concept of borrowed resilience. So this means fragile endurance, where authoritarian governance is very much built on symbolic engineering and citizen workarounds. Uncredited labor, relying on the invisible labor of ordinary people. Which brings us to ask that we ask figuratively about future governance during future pandemics. And we ask, for China, can political legitimacy be built through recognition and reciprocity instead of narrative control? And so that brings us to a close. And of course, we invite questions, but we also invite anyone who's interested in this project, questions, ideas, anyone who wants to collaborate to reach out to us. Thank you so much.